Today we're going to talk about spinal stenosis with instrumentation, which is basically just spacers in this regard. So there's the continuum of care Stan alluded to. You could try epidurals after they failed conservative care. There's the pilot procedure. There's indirect decompression, typically indicated for those moderate stenosis patients with grade 1 or less spondylolisthesis and less than 3 millimeters of active translation between flexion and extension. There's also direct decompression or laminectomy, and then with or without fusion. Those are indicated for the more severe stenotic patients, as well as if they have gross instability or grade 2 or more spondylolisthesis. Basic biomechanics of the spine, we know that when patients are standing upright, laying flat on their back or on their stomach, it puts the spine into extension, which narrows the canal, and the foraminal height, which could put compression upon those nerves and cause symptomatology. But when they flex forward or lean forward, you get the classic shopping cart sign. It opens up the space around those nerves, as well as the blood vessels. A lot of people